Henry. Dr. Henry, you've been the Chief Medical Health Officer since 2014. In 2014, there was a death rate per 100,000 of 7.9. It skyrocketed to 30.3 in 2017, just over 4 years under the Christy Clark government. Since then, it has gone up as high as 46.2 and now at 40.3, a 33% increase versus a 383% increase under the Clark government. So when you hear politicians throw out anecdotes that they blame safe supply or decriminalization for the causation of the spike in the toxic drug crisis, can you explain the harm that might cause? And I will cite that Alaska's death rate went up 45% last year without decrim, without safe supply. Alberta went up 17%, Saskatchewan 23%. Baltimore has a death rate of 190 per 100,000 versus 40 in BC without decrim, without safe supply. Can you talk about the importance of peer-reviewed research instead of anecdotal policy?
Well, thank you for bringing that up. And I think it is important to recognize that many of the issues that we're dealing with, and we've talked about that, are related to underlying concerns and issues that people have. We know that when homelessness goes up, when poverty goes up, when income insecurity, inflation, all of these things drive anxiety, mental health issues that lead people to increased substance use. So it is important for us to look at data, to look at what is it that supports people across the spectrum of people who use drugs. And so I think it is important for us to not focus on one single thing, one particular thing, and try and make points or political points, because it is harming those who we all, I believe, want to include in our community and to help find their way to their road to recovery.
Dr. Bach, you worked really hard on an evidence-based and expert-led project there at Road to Recovery. Can you talk about the harm that disinformation causes to you and your team and the work that you're doing on the front line?
Absolutely. I work with tremendous colleagues in my institution and also all across Canada. I think there's really good people who see viable solutions and are working towards them. I can say that as I mentioned in my remarks, that seeing many of these complex issues really oversimplified and to be frank, often made to be such political issues, it's really challenging for those who are working on the ground who do all work alongside one another, despite many differing opinions, who do see that complexity and that need for different responses in different contexts. To see this turned into something that has become a political issue. It's very challenging. It's very distracting. It's very demoralizing, and I think it really prevents us from really talking with the level of sophistication that these topics deserve.
Thank you.